The next group was what I was supposed to. I thought actually, I'll go to the another two groups, which is very interesting, as all of we know that the already Dr. Matali and the Dr. Ganga has already covered what could be the post papilloedema optic atrophies. So I'll just skip this. As we know that the IIH and intracranial space occupying lesion are one of the commonest. However, there could be the other entities where there could be a kind of obstructive hydrocephalus. So this was a case which like presented like this. There is a tortuosity with a gross optic disc pallor, and on MRI imaging, what we found that there was a very rare, interesting entity that was craniosynostosis with osteopetrosis and type 1 Arnold Chiari malformation, which was responsible for the optic atrophy. So take home from this, like optic atrophy in patients with the papilloedema, post papilloedema optic atrophy. Retrospective inspection is very important. The history and previous documentation plays a vital role that warrants an early diagnosis and treatment to prevent the morbidity as well as mortality, being the intracranial space occupying lesions could be a life-threatening. Neuroimaging is a modality of choice for the diagnosis of post papilloedema optic atrophy. So now coming to this group, which is very important, most of the time like it can be missed, being usually present in the children's, as the first case, 8-year-old child, defective vision in both eyes since last 3 years. There was a history of jaundice at birth, for which he had undergone the light therapy. But the important history that was clinching is there was a history of twins with there was some mental handicap. If you look at the fundus photograph, there is a diffuse disc pallor. It's sometimes very difficult to distinguish whether it is a glaucomatous or a non-glaucomatous. The child has fixing and following of light, the visual acuity, and there was a sluggish pupillary response in both the eyes. What we found on neuroimaging, there was focal parieto-occipital cortical atrophy, which was suggestive of the sequel of hypoxic ischemic encephalopathy. Very similar, but little more elderly patients, 30-year-old, again presented with the central pallor with a large size cuff. He has a exotropia as well. He presented with the vision of counting fingers since his childhood. Again on neuroimaging, there were bilateral occipital lobe atrophy with the left-sided porencephaly. There was enlargement of lateral ventricle on the left side, so which could manifest as the central optic disc pallor, which can mimic. And the last case, which is 43-year-old, quite elderly patient. If you look at the history of this patient, this patient was already diagnosed as the glaucoma patient, undergone the HVF. He was on treatment for timolol. But if you look at carefully, what was the history which was clinching, he has a premature delivery. There was a birth weight, which is a low birth weight child. He cried immediately after, which the history was little doubtful. So it could be, the delayed cry could be one of the factor where we can think of, the neurodevelopmental anomaly. And the child had a history of seizures at the age of 1 year. So look at the disc. Again, the rim, it looks 360-degree normal. But here the size of the cup, which is pale. That is again, if you have a cursory look, you can always think of, are we dealing with the patients with HI. This patient had a visual acuity of 20/400. With correction, it was 20/25. So that was the reason which was misleading. Being a normal vision, always whenever the patient keep on consulting different the ophthalmologist, it was always turn out as it is a glaucoma. But if you look at the fields also, again, it's very difficult to say that these are the only glaucomatous field. But if you look carefully, they have a little bit they are respecting to the vertical line. And on neuroimaging, there was a bilateral occipital lobe infarcts. So which was again suggestive of, the sequel of hypoxic ischemic encephalopathy. So this was the last case, last group, that is a methanol poisoning. This was a 50-year-old male farmer by occupation, presented with sudden loss of vision in both eyes for last 6 weeks, and history of spurious intake of the adulterated alcohol. So you can see there was a mild temporal pallor with counting finger vision, and on neuroimaging there was the hyperintensities in the basal ganglia. So after treatment with IVMP and oral steroid, it has recovered to 2200. So I think we'll stop here with short of time.